let's start discussing the question paper of RRB 2019. This is shift 2 question paper and part 1 question paper. Let's start the question discussion. First question, the most common cause of embolism is, the options are thrombus, air bubbles, atheromatous debris and bone fragments. The right answer is thrombus. Thrombus is the most common cause of embolism. The next question, myopia or nearsightedness is corrected by using, the options are cylindrical lens, concave lens, bifocal lens, convex lens. In myopia, the concavity of the lens is decreased. So the right answer is, corrected measure is concave lens. Next question, the normal human body temperature is maintained by, options are fat, carbohydrate, fiber and protein. The right answer is fat. Fat is responsible for maintaining our human body temperature. The next question, dash denotes one who never completed a pregnancy to the stage of viability, that means 28 weeks. The options are nulliparous, multigravida, puerpera and nulligravida. The right answer is nulliparous. Nulligravida means the woman who have never pregnant. The next question, the process involved in the development of mature ovum. Mature ovum development process is known as, the options are oogenesis, fertilization, gametogenesis, spermatogenesis. The right answer is oogenesis. The next question, the larynx is closed during swallowing by, the options are epiglottis, cricoid cartilage, vocal cord and thyroid cartilage. The right answer is epiglottis. Next question, how are ECG changes presented in ischemia and myocardial infarction? The options are as a small Q wave with an elevation in the ST segment and a peak or inversion in the T wave. Second option, as an elevated PQRS, as a longer Q wave and T wave, as a depressed ST segment. The right answer is at first as a small Q wave with an elevation in the ST segment and a peak or inversion in the T wave. In the first hours and days after myocardial infarction, some changes can occur in the ECG. First, large peak T waves or hyperacute T waves, then ST elevation, then negative T waves, and finally pathological Q waves develops. The next question, what information the nurse should consider while collecting the history of a child with suspected rheumatic fever? The options are a fever that started 2 days ago, vomiting for 2 days, lack of interest in food, a recent episode of pharyngitis. The right answer is a recent episode of pharyngitis, because rheumatic fever is caused by a bacterial infection, streptococci. So pharyngitis also an infection caused by the streptococci. So as a nurse, I should at first to the history of the patient if any pharyngitis symptoms is present or not. Then, the storage of carbohydrate in animals is as like, the options are starch, glycogen, glucose and heparin. Here is in animals, so the right answer is glycogen. If the question is in plant, so the answer will be the starch. Next questions, pedophilia is a form of, options are child sexual abuse, physical abuse, verbal abuse and mental abuse. The right answer is child sexual abuse means pedophilia. Pedophilia refers to the recurrent sexual urges and behavior towards pre-pubertal adolescent children for at least 6 months. The next question, the arterial blood gas or ABG analysis report shows that decreased bicarbonate level and pH value. Decreased pH value means alkalosis and decreased bicarbonate value means, decreased pH value means pH normal value is 7. If decreased from 7, it is acidosis, and increased from 7, it is alkalosis. So decreased pH value, that means it is of course acidosis, and decreased bicarbonate, that means it is metabolic. So the right answer is metabolic acidosis. Then, isotope of cobalt is used in the treatment for which of the following disease? The options are